Hey guys, let's just make sure that everything is running and I'll wait for 2 or 3 minutes for people to join because this is more fun if there are more people since it's an MCQ marathon today that we are doing. Guys, let's just make sure. Sorry guys, give me a minute. There's some technical issue which I'm not able to figure out. Sorry guys, give me a minute. There's some technical issue. Balaji, I hope you're still there and you can make out what I'm saying. Okay. So let's start, guys. Welcome to Let's Crack NEET PG, the YouTube channel of Unacademy, the learning app, right? And we are going to be doing, so I'm sorry, first of all, for the delay. I actually had gone ahead with 3 questions and I wasn't able to make out that the stream was not running because when I started it, it was showing me that it was live, but somehow, I don't know, the stream got interrupted in between. Okay, so I'm going to start again. So welcome to Let's Crack NEET PG, the YouTube channel of Unacademy NEET PG, India's largest online learning platform, where you'll have top educators, the quality content that you deserve, and I assure you that you'll have a great learning experience. Now you must be wondering that who am I? My name is Chetanya Mittal. I'm a first year MBBS student at All India Institute of Medical Sciences, in fact third semester now, at AIMS New Delhi, India's best medical college. All India rank 4 in AIMS, All India rank 5 in JIPMER, and I had a decent score in the NEET UG examination, and I'm also a KPY and NTSC. So today we are going to be doing the MCQ marathon for the head and neck part 1, right? So we are going to be doing around 50 questions today, okay? And then we are going to have 2 sessions more. So we are going to do a total of 150 questions in this marathon in 3 parts, right? So that you don't have to spend too much time online together. And so what all have we covered so far? If you know from your BDC, what is the first chapter? The first chapter is osteology. I have skipped that. So I have covered scalp, temple, face. I have covered orbit. I have covered nasal cavity. I have covered pharynx. Okay. So for your profs, you can definitely see these videos. And then besides that, I have covered in very great detail 2 topics. One is cranial nerves number 1 to 12, and then the blood supply of the head and neck plus the blood supply of the brain. Okay. So all of these topics I have covered in less than some 10-12 hours. So even if you spend one day, you'll be able to be very confident with all the basic concepts of head and neck. Okay. That is why I'm starting with the MCQ marathon to make sure that whatever miscellaneous concepts are left, we are able to cover those. Okay. So that is the objective behind doing all of this. And I'm going to start now. And this is all going to be very useful for your assessments, for your Viva, for your NEET PG entrance, and all of that, right? So I have to tell you a little bit about the Plus subscription before I begin. So first thing about this is that there are a lot of experienced educators here, right, who will be taking structured courses on everything. So you have the option to learn from anyone. That is one of the best parts. And you can see all of these courses are locked, which shows that all of these are actually structured plus courses. Okay, and you can see that some of these have even 291 lessons, 8 lessons. So you can learn according to your own needs. So that is one of the best parts. You have free special classes. So even if you don't plan on taking the subscription, do download the Unacademy Learning app so that you can access all these classes, right? Then I will move on and tell you about test series here. So the good part about downloading the app is that you can also attempt these free mock tests. Since we are all medical students, we all have a busy schedule, we all have a tough schedule. I have my exams coming up soon. So it is great if you have a flexible schedule. You can enroll at your ease, you can attend classes at your own time. You can learn in whatever language you want. You can learn in English, you can learn in Hindi, you can learn in Malayalam. There are people teaching in Tamil, right? And you can have unlimited practice. You can retake all your quizzes. And see, right now you can chat with me. I am viewing your live stream here and I can see the chat. You have the option of attempting interactive polls. You can learn basically anytime, anywhere you want. And all you have to do is go to the Play Store, download the Unacademy Learning app, and you'll be through with everything, right? So these are all the plans that are available. I'll come to the latest plans later, right? So this is the plan that I ask a lot of you to take. That is the 1 year or the 2 year plan. Whenever anybody asks me, I say 1 year or 2 year wala le lo, because that is the most economical according to me, right? And that is also not too much commitment. And you can either bill it as a one-time payment, or you can also use the option of EMI. Yeah. So this is, see, like you can see that this is costing you 40,000 right now. But there's an option here to enter a referral code, that is like a discount coupon code, right? And the coupon code that you have to use is Chetanya10, right? And if you use this code, I'll tell you what are the benefits. First, you get straight 10% off. ठीक है, वो तो सबके code में मिलेगा. If you contact me, I'll also tell you how to use these learning credits so you can get a 20% off. And since you're going to be using my code, I'll also give you some other perks. You can join my Telegram channel at the rate NEET PG Chetanya. Get to know more about the subscription and everything. So you can join this channel, you can join the discussion group. That is how you have to enter the code, click on apply, the discount will reflect here, and then you can take the plan. So this is for the 3 month plan, and that is about. So these are all the courses that are there. These are the latest courses, Unacademy plus this. And this is the iconic subscription. So this is the one I'm going to tell you about, where you get all the benefits of Unacademy Plus, which is already India's largest online learning platform. And you also get all the benefits of Prep Ladder. So I hope you know that Prep Ladder has a lot of experienced teachers like GRG sir for pharma. And then you have Ortho Ka Dhoom Dhadaka, right? ODT by Apoorv Karwa or Ortho, right? So you have some stuff here which is really good, and it is something I would personally recommend to you. For 3 years, take this plan, 36 months, cost you 82,800 after you have gotten a 90 to 100 rupees discount with my coupon code, that is Chetanya10. And it will cost you only 2,300 per month, right? So this used to be the cost of 1 year of UG coaching, whereas now you can get 3 years of PG coaching at that cost. Yeah, and it is a must take. Now let's start with our marathon right now. I hope you guys are ready. I hope you guys can see the slides. There are no technical errors. I am sorry for the initial lag, for the initial error, right? Yeah, so I hope you guys are able to see the slides. You all can see the first question. Please write yes if you are able to read what is there on the slide. Okay. The first question is, a 68-year-old woman presents in the emergency room in the ER, right, with dizziness and nystagmus. So first thing that you have to note here is dizziness. Second thing here is nystagmus. Then examination findings reveal that there is a loss of pain and temperature sensation over the right side of the body, of the face, sorry, the left side of the. Okay, so this is an important statement. Third, there is a loss over the right side, and the patient exhibits ataxia. So fifth symptom that you see here is ataxia, and there is intention tremor. Right, both are on the right side in the upper and lower extremity. And you can see that the patient cannot perform finger to nose touching or even heel touching tasks. In addition, she is hoarse, that is, her voice is hoarse, and she demonstrates pupillary constriction and drooping of the eyelids on the right. Finally, the right side of her face higher than the left. Which of the following artery block would explain the patient's condition? What is your answer, doctors? Which of the following artery block would explain the patient's conditions according to you? Which of the following artery block would explain? Your options are right pica, left pica, right ica, and D is basilar. First, try to identify what this question is going to ask from you. And then see if you can successfully answer it. I'll be waiting for all your responses for a minute at least. If you don't know the answer, please write I don't know in the chat so that I can understand that there is some confusion that I need to resolve in detail. Anybody? People who are watching? I read the question for you. Since I hope you are not able to see the top right corner. I understand that there is my face there in the top upper right corner. Alright. I'll tell you, this is the answer. First of all, this is known as the lateral medullary syndrome. So I told you about two syndromes in the class on the blood supply. One is the lateral medullary syndrome, the other is the medial medullary syndrome. This is also known as Vigerin syndrome, right? Now, why does this occur? This occurs due to an infarct of the anterior spinal artery, and this occurs due to an infarct in the posterior inferior cerebellar artery, right? Now, this is the cross section here at the level of the medulla, where you'll have the olives at the level of the olivary complexes, right? You can see first, this is the hypoglossal nucleus, and you have the hypoglossal nerve coming out, right? So this will be affected in the medial medullary syndrome. But in the lateral medullary syndrome, this is the part that is affected, the one that is shaded here in red. So where the first nucleus that will be affected will be the vestibular nucleus. Now, due to the damage to the vestibular nucleus, you have the nystagmus and the vomiting and the dizziness, right? Then, yes, Tejaswini talks absolutely correct. The answer is right, pica. Second, you have damage to the spinal tract here, right? The spinothalamic tract is damaged, so you have contralateral loss of pain and temperature. See, the patient had loss of pain and temperature on the left side of the body and right side of the face. Since it is contralateral, left side of the body is affected, so the right side will have the lesion. So lesion is on the right side, and you can verify that by looking at the spinal nucleus of trigeminal, where you'll have ipsilateral facial loss of pain and temperature. So that is why the lesion is on the right side. The damage is also there to the nucleus ambiguous here, right? So trigeminal nucleus, nucleus ambiguous. Because there is damage to nucleus ambiguous, what is there? There is hoarseness of voice. There is hoarseness of voice, and you have damage to the sympathetic fibers, that is the sympathetic trunk, which carries ipsilateral fibers of sympathetic. So you can see that there are these three symptoms: pupillary constriction, drooping of the eyelid, and this is anhidriosis. This is ipsilateral Horner syndrome of the right side. So you will have damage to the sympathetic supply. So this is Horner syndrome, right? The answer is option A. Let's move to question number 2. A middle-aged woman, a complaint that her right hand tremors when she attempts to insert a thread in the eye of a sewing needle, and her body, it sways towards the right side while walking, right? So I will write the question middle-aged. So I hope I can make out that you are not able to see. Right. So this is here it is written right-handed tremors. Then the next line is eye of the sewing needle. Her body sways towards the right while walking. Then next it is written on physical examination. This word that is missing here, it is on physical examination. Physician found that there is a flaccidity of limb muscles on the right side, and when she asked to touch the tip of her nose with her right index finger, the finger tended to overshoot the tongue. Which part of the brain is affected? Can you tell me which specific part of the brain is affected? You have four options: basal nuclei, thalamus, cerebellum, and cerebrum. And tell me which part will be affected. One specific. Do you have any answers, doctors? This is a relatively simple question. Balaji V, if you're still watching, or Tejaswini talks, let me know the answer. I'll give you 30 seconds more. The correct answer here is cerebellum. Okay. First, let's look at what are the functions of cerebellum. What are the functions of cerebellum? Draw this triangle whenever you think about the functions of cerebellum. First function is that cerebellum is responsible for the tone of muscles. Second thing that the cerebellum is responsible for is equilibrium. Third thing that the cerebellum is responsible for is fine motor, right? Since it controls these three things, any lesion of the cerebellum will have a loss of all these. So loss of tone of muscles is called as placidity. It is called as placidity. Loss of equilibrium, posture, and balance is known as ataxia, and you will have loss of fine motor function. So you can see that this right-handed tremors when she inserts the needle is loss of fine motor coordination. There is ataxia, she sways towards the right side, so she walks like an alcoholic, and you have placidity of these, right? Her finger also overshoots the target. The answer is C, cerebellum. Question number 3. Damage to the structure producing the elevation mark leads to paralysis of which of the following? Okay. This is an easy question. Question number 3. If you are smart enough to answer this, you should be. There is a structure that has been marked by this arrow. I hope you can make out what that structure is. And once you are able to make out what that structure is, we can discuss what the answer will be. There is now oval elevation that is present. So as you can make out, this is the diagram of the floor of the fourth ventricle, and let me tell you guys that this diagram is a must know, right? So ultra important. When you write your answers, write question number 3 and write your answer as, let's say, 3. Simple question, guys, giving you last minute to answer. Right. The correct answer here is Risorius, option B. The lateral rectus, it is supplied by cranial nerve number 6. Risorius is a muscle of facial expression, so it is supplied by cranial nerve number 7. Levator palpebrae superioris has a voluntary and an involuntary part. Involuntary part is supplied by sympathetic fibers of T1. Voluntary part is supplied by oculomotor nerve number 3. Superior oblique is supplied by cranial nerve number. Alright. So you have to know that this is the facial colliculus. So what is the facial colliculus? This is the abducens nucleus, the motor nucleus of the facial nerve. And the facial nerve, it coils around like this, forming an internal genu here of the facial nerve, and that produces an elevation here known as the facial column. So any damage to the facial nerve will lead to loss of muscles of facial known as Risorius. So this will be an infranuclear lesion, right? Question number 4. The Marg structure in the diagram is involved with motor activities. So, मैं आपको ये बात कॉल करूँ 7 o'clock. Right. Anyway, sorry guys. So I hope you are able to write the answer so far. What is the answer? The answer is which of the following does it not receive afferents from, right? So there is a Marg structure here. I hope you can make out that this is a horizontal section of the cerebrum. So you have the corpus callosum in the center, and this is kind of the thing that is drawn. So this is the, if you can't make this out, this I'll tell you that what the structure is because the diagram isn't very clear. This is the corpus striatum, right? This is the corpus striatum. So now tell me what your answer will be. So what does corpus striatum not receive afferents from? So it is said that there is a structure, this is a Marg structure, and I've already told you what it is. Your question is, it receives afferents from all of the following except. Are there thalamostriatal fibers? Have you heard of thalamostriatal fibers? Yes, there are thalamostriatal fibers. Then there are corticostriatal fibers, right? There are also nigrostriatal fibers, but there are no fibers that are known as spinostriatal fibers. So it receives inputs from these three areas and it is responsible for your tuning of movements. So answer is A, spinal cord. There are no efferents from the spinal cord. So basal ganglia here, right? Question number 4, the answer is A. I hope the questions are clear to you, more or less. Question number 5. A patient recovering from a traumatic injury to the face now finds himself unable to chew his food. On physical examination, his jaw, it deviates to the right side. The nerve that has been injured in this patient exits the skull. It exits the skull through which of the following flow? So there is a damage to a nerve where he is unable to chew his food. Unable to chew his food. And second, there is a turning of the jaw. Turning of jaw to right side. All you have to tell, so it's obviously a cranial nerve injury. So what you have to tell is that that cranial nerve, which foramen does it exit the skull through? Right? Which foramen does it exit the skull through? Anybody? It's a very easy question. Alright? Not a difficult question. You can directly eliminate two options. There are only two options that will be left. Right? First, tell me which are the two options that you can straight away eliminate. So again, we have covered this concept in our cranial nerves class. So if you haven't watched that lecture already, please do. I'll just check. Yes, once again. Yes. Sunny Yadav is saying the answer is B. Absolutely correct, Sunny Yadav. Sunny Yadav has given the fastest answer and the first correct answer of today after right Paika. Right. So as you can make out, foramen spinosum, its contents are, its only nervous content is nervous spinosum, which does not supply any muscle here. So the answer will not be C. The answer will not be D because foramen lacerum does not have any contents passing through it. So only foramen rotundum and ovale ref. From here you will have V2 passing and here you will have. So the person cannot chew his food. So what is affected? Muscles of mastication. And you all know muscles of mastication. They are all located in the uh, first arch. They are all first arch muscles. So they'll be supplied by the mandibular division of trigeminal. So the answer will be B. Why does the jaw deviate to the right side? Because the actions of the medial and lateral pterygoids, which are again supplied by the mandibular nerve. Right? Question number 6. Examine the following picture. Right? This can also be a question in your ophthalmology. Which of the following is damaged depending on these findings? So you have to identify which nerve is damaged, right? You have some options: abducens nerve, facial nerve, trochlear nerve, and oculomotor nerve. So you have all these four options and you have to tell which nerve is. Sunny Yadav, आप ही बताओ आंसर. ध्यान से देखो पिक्चर में, देखो व्हाट इज हैपनिंग हियर. D, very good. Sunny Yadav is saying D, but ये आंसर गलत है. Oh. So I'll tell you the correct answer. The correct answer is option A. It is abducent nerve damage. Why? So see, what we were getting the patient to try to do. First, we said to the patient, look to the left. We said look to the left. Then we said look forward. Then we said look towards the right. Okay. So what all muscles are involved here? First, to look to the left. This is the left side of the eye. This is the right eye, right? So left side he had to move the medial rectus. Here he had to move the lateral rectus, but he could not do that. So his right lateral rectus is not moving. That means there is a damage to the right abducent nerve. See the answer over here, right? Look forward, he is able to do it finally, but there is a slight here strabismus towards the medial side. थोड़ी सी medial deviation हो रही है इसमें, है ना? So that is again because the lateral rectus is not able to control the function. Then when you told him to look towards the right, he's able to easily do so. This lateral rectus is working, this medial rectus is working, and this lateral rectus. There is a damage to the right abducent nerve because that is the one that supplies the lateral rectus. Question number 7. Which of the following clinical finding is not seen in lesions or structures that pass through the jugular foramen? The structures that pass through the jugular foramen should know. I told you there is an anterior and posterior aspect to what passes through the jugular foramen. Actually, there is an anterior, there's an intermediate and posterior. Okay, posterior is basically just a posterior meningeal artery. Anteriorly, what do you have? You have the inferior petrosal. What are the structures that are present here in the intermediate part? It's called posterior part is considered. Sunny Yadav, answer to the 7th question for me, please. D. Okay, no, D is going to be there to have loss of taste sensation in the posterior 1/3 of the tongue actually. D is not the correct answer. प्रियांश नीट यूजी वालों के लिए ये नहीं है because ये सब MBBS stuff है, right? So you will not be able to understand this. If you are able to understand it, you are trying to attend, but you will not be able to understand this. If you have cleared, if you have attempted your NEET examination already, then you can watch the video. You appeared in 2020. So here you have the 9th, 10th and 11th cranial nerve passing through, and the 9th nerve supplies the palate, the 10th has some fibers coming from the palate. So this is not going to be there. The palatal paralysis is wrong, right? Then the difficulty in shrugging, because this is going to be there, so this is wrong because the 9th and 10th nerve. Then difficulty in shrugging of shoulder, yes, because spinal root of accessory. The spinal root of accessory supplies the trapezius, which is responsible for shrugging of the shoulder. So this is also going to be there. Loss of taste sensation from posterior 1/3 of the tongue is blocked by the glossopharyngeal nerve. So this is also going to be there. The loss is going to be there. So this will not be there, as Mishti has also given the correct answer now. So the correct answer here is option C. The correct answer is option C. So we are done so far with 7 questions. Question 8 is an easy question. I've already discussed this one. That what does the Dorello's canal transmit? Dorello's canal transmits. Dorello's canal transmits. Which of the following? What does Dorello's canal transmit? It actually transmits two structures, but only one of them is in the options. Now, Dorello's canal, this is the apex of the petrous part of the temporal bone. And here you have the Dorello's running, with this having the petroclinoid ligament. Answer is correct, Mishti and Sunny Yadav. Can you tell me what is the second structure that passes through Dorello's canal that is not mentioned here? What is the second structure that passes through Torello's canal? Yes, so you are right. The answer is D, abducent nerve. So abducent nerve passes with the again with the inferior petrosal sinus here, and that those are the contents of the Torello's canal, right? And that is the reason why there is a very sharp turn here, and abducent nerve is commonly involved in. Then there is an increased intracranial pressure. Question number 9. Artery lying deep to the marked area in the given pic is branch of which of the following? So there is an artery that is present here, right? It is a branch of which of the following arteries? You have to tell which branch does it come from. I hope you can make out that what is this region called. This is known as the pterion. This is known as the pterion. Yes, inferior petrosal sinus. Absolutely. Maxillary artery. Right, absolutely correct. This question is a little easy for you. Since you know here, what you have is the middle meningeal artery running deep to it, which divides into the anterior division and the posterior division. And this anterior division is commonly involved, especially in the extradural hemorrhages, right? So there might be injuries here. That is why middle meningeal artery is very clinically significant. I hope you know it is a content of the foramen spinosum, and it is a branch of the first part of the maxillary artery. And what was the mnemonic that you had to remember for the first part of maxillary artery is pehla admi. Pehla admi. Pehla means first part of maxillary artery, and admi is auricular, accessory meningeal, deep tympanic, middle meningeal, inferior alveolar. So these are the 5 branches, and M, middle meningeal, is a branch of the first part of the maxillary, right? Question number 10. Which of the following, one of the following opens in the middle meatus of the nose? So you have to tell which opens in the middle meatus of the nose. Yes, Sunny Yadav. Sunny Yadav, did you know the mnemonic before or did you learn it from my class? Middle meatus of the nose. Asan question है question number 10. Just answer quickly. Maxillary, absolutely correct answer. Now nasolacrimal duct, it opens into the inferior meatus, right? Eustachian tube opens into the nasal pharynx. You have the tubal prominence here also, toro, right? Um, Sphenoidal air sinus opens into the sphenoethmoidal air recess. Answer is D. Question 10, the answer is D. Answer is maxillary air sinus. You should know it has one of the smallest openings, right? Because it is the opening is small by itself, and it is also covered by your fatty, right? Your you're not fatty, your mucosal regions. Question number 11. Lateral wall of cavernous sinus. Lateral wall of cavernous sinus contains all of the following nerves except, so it does not contain one of the following nerves except. Which nerve does the lateral wall not contain? So the mnemonic that I had told you a mnemonic here. If you want to remember it by a mnemonic, you can also remember it otherwise also. A mnemonic, so give you 1 or 2 minutes to give me an answer. मोहम्मद मुनीर has written D. Very good. मोहम्मद मुनीर ने बहुत प्यार से लिखा है एंट्रोक्वानल पुल. Right. So 11th का answer is D, abducent nerve. Yes, because sixth nerve is the sexy nerve, right? So sexy nerve कमरे के अंदर से जाएगी, कमरे की दीवार में बंद नहीं रहेगी, ठीक है? तो ये इसमें से होता है. The mnemonic here is O Tom Cat. O Tom Cat, right? where this is the oculomotor, this is the trochlear, this is the ophthalmic division of maxillary, this is the uh, this is the ophthalmic division of trigeminal, this is the maxillary division of trigeminal, this is abducent nerve, and this is the carotid, internal carotid, right? Question number 12. Palsy of the right genoglossus. Palsy of the right genoglossus causes deviation of tongue to which side? Or causes deviation of the soft palate to which side? Soft palate, tongue, soft palate, tongue. Right? So what is going to be your answer? Question number 12. Okay, let's do this quickly so that we are able to cover all the questions in, let's say, another 1 hour. Sunny Yadav, तेजस्विनी, मिष्टी, मोहम्मद मुनीर. Okay, सनी यादव ने सबसे पहले आंसर दे दिया. Deviation of the post of the right side, absolutely correct. Here you have ipsilateral division. Why? Because the genoglossus, its functions are something like this. Genoglossus of the right side pushes the tongue towards the left and the other way around as well. ये क्या हो रहा है? तो भर लिया. So the action is something like this, that it causes deviation of tongue to the side. So if there is a palsy of the right, so the deviation will also be towards the right, because the left one will be overactive and it will push it towards the right side. Yeah, so answer is A. That is unlike most other places where you have deviation towards the opposite side. So safety muscles of the larynx. Which is the safety muscle of the larynx? Question number 3. Safety muscle. Safety muscle of the tongue is genoglossus, which is the safety muscle of the larynx. And why do we call it the safety muscle? Write your answer as 13A. 13. इसकी सही तरीके से आंसर लिखती है. 5 questions. 13C. Very good. Posterior cricoarytenoid. Answer is posterior cricoarytenoid, like Tejaswini pointed out, because it is the only muscle that abducts the vocal cord. So it keeps the airway open. Because it keeps the airway open, since it abducts the vocal cord, it keeps the airway open and it allows you to keep breathing. Otherwise, vocal cords are not abducted, you will not be able to take breaths. You will not be able to breathe. That is why it is the safety muscle of the. Question number 14. Parotid duct passes through all of the following structures except. Parotid duct passes through all the following structures except. So you know the parotid duct, it has to pass through a few structures, pierces them. It's a direct point written in your BT Chaurasya if you are from the first year. Otherwise, also parotid duct, has to come from the parotid gland and it has to enter the mucosa of the. There are a few structures that are pierced in between. Question number 14. What will be your? Absolutely correct. Masseter. It does not have to pierce the masseter. It has to pierce the buccopharyngeal fascia, right? It pierces the buccopharyngeal fascia. It pierces the buccinator and it pierces the buccal fat of pad. Especially buccal fat of pad is very prominent in children. So it pierces 3 structures, all begin with B. Yeah, so B pierce करता है, right? Question number 15. Muscle responsible for intorsion of the eye. Which muscle is responsible for the intorsion of the eye? So fastest answer for the 14th question was given by Mansi Shroti. Welcome Mansi Shroti to the competition. And this fastest answer was given by Mansi. Question number 15, which is the muscle which is responsible for intorsion of the eye? Now इसके लिए मैंने बहुत प्यारा कॉन्सेप्ट बनाया था, ऐसे वाला है ना, देखा है, ये एक डायग्राम सा होता है, where you draw all the muscles like this. I told you the mnemonic for this, that was S-I-N. S-I-N. Sin. Okay, so Mishti has given the fastest answer. She's saying the answer is, C, both of the above. Absolutely correct. Because here sin means superiors are in tauters. Superiors are in tauters. So that is the correct answer. It is C. You can also do it through this diagram. You can go to the lecture of the orbit if you don't understand. Question number 16. Nerve to the pterygoid canal, median nerve, is formed by. So which of the following nerves form the nerve to the pterygoid canal? Again, a very good question. Frequently come across it in your theory. Fifteenth ka A, very good. Nerve to pterygoid canal is formed by the combination of the deep petrosal nerve and the later petrosal, right? Okay, anybody else wants to take an answer on question 16? Although I think option A is correct, so we should move on. Mohammed Munir is also attempting. Okay, very good answer, Mohammed. Question 17. Primary auditory area. Which is the primary auditory? चलो ठीक है, इस question में पूछा नहीं है. If you know it, you should also know the Broadman's area for primary auditory. What is the Broadman's area for primary auditory area? Primary auditory area. Primary auditory cortex. 17. I think you don't know the answer. Probably the answer is going to be superior temporal gyrus, right? Superior temporal gyrus, the answer. And it is also known as Brodmann's area. Brodmann's areas, a few are important. This is Brodmann's area 22. This is Brodmann's area 20. Question number 18. A 46-year-old man, no, not 41, 42. You're right, Mishti, in your answer. But the area for primary auditory cortex is area 22. 41, 42 I think also are there. There is some confusion, I think, according to, as far as I remember. If you look at Bard's anatomy, it has something different, and if you look at your Vishram Singh, it has something different. So I think that might be responsible for some confusion. I think, yeah, you're right. 41 is the also present in the temporal superior temporal gyrus only, and 42 is the posterior part, the temporal area. 22 होता है, मतलब मैंने जितना पढ़ा है 22 है for primary auditory cortex, and then you have secondary region for Wernicke's area, where you have your language comprehension. That is U22, 39 and 40. There you consider area number 22, 39 and 40, right? So maybe 22 is counted more towards that, but it is also part of the primary auditory cortex. And then 41 and 42, I guess, are also part of the auditory cortex. Question number 18. A 46-year-old, a 46-year-old man complains of dryness of the mouth, right? On examination, he lacks salivary secretion from the submandibular gland. This indicates the lesion of which of the following nervous structure. So you have to basically tell that which of these supplies the parasympathetic fibers to for salivary secretion, right? For salivary secretion of the submandibular gland. So I guess you know that there is a nerve that passes through. It has to be a branch of the facial nerve because the submandibular gland is supplied from the superior salivatory nucleus, which is the parasympathetic nucleus, the general visceral. It is the general visceral efferent. Superior salivatory nucleus is the general visceral efferent of the seventh nerve. So it has to be related to the seventh nerve, and we did this in our facial nerve, right? So the answer here, correct answer, is anybody going to take a guess? Correct answer here is the chorda tympani in the middle ear cavity, right? Chorda tympani carries two types of fibers. One, it carries the general visceral efferent to the submandibular gland across the middle ear, and then it brings back the taste fiber from the anterior one-third of the. These are the two things that chorda tympani does, and the answer is B, as correctly pointed out by Mohammad Munir in his second attempt, and Mishti also. Right? So question number 19. Anterior belly of digastric is a derivative of, right? So if you remember its nerve supply, if you remember the nerve supply, you'll be able to guess. It is a muscle that is supplied by two different nerves. The anterior belly is supplied separately, the posterior belly is supplied separately, right? While around the pulley, have the anterior belly of digastric and the posterior belly of digastric, which runs with another muscle known as stylohyoid. First brachial arc is absolutely true because it is supplied by the mandibular nerve, right? There is a branch that goes that is known as the inferior alveolar nerve, and it gives the nerve to mylohyoid and nerve to anterior belly of digastric, right? The posterior belly of digastric, it is the second arch muscle because it is supplied by the facial nerve. It is supplied by the question 20. Anjali is also given the right answer. Welcome, Anjali. Question 20. Which part of the ear has origin from all the three layers of the germ layer, right? So which of the following has ectoderm, mesoderm, as well as endoderm? So there's one tissue here consists of all three. Twentieth B, very correctly pointed out by P. Niharika, right? So there are three things. The innermost part is made of endoderm, the tympanic membrane. The outermost part is made of the ectoderm, and in between you have endoderm. So that's a typical arrangement that is seen in tympanic membrane. A good question here. Question 21. Okay, this is a question I have discussed in the lecture. There is a superficial cut in the region of the middle part of the posterior triangle of the neck. Alright. So this is the sternocleidomastoid, this is the trapezius, and the clavicle. This is the posterior triangle. Here you have some structure running, and there is a cut in the region of the middle part of the posterior triangle of the neck. Patient will experience problem in. What will the patient have some problem in? Patient will have problem in. So think of which nerve would be damaged. Think of which muscle would be damaged because of that. Answer is C of 21. B Niharika is going bang on. I think she has been giving the fastest answers for the last two questions. And this is the spinal root of the accessory which will be damaged, right? Niharika, can you tell me which muscles will be damaged when the spinal root of accessory is damaged in the posterior triangle of the neck? Which muscles will be damaged? No, the answer is not D, abduction of the arm right now, because the shrugging of the shoulder is one of the more significant actions. Although overhead abduction does have some role of, right? There will be C. Pronating scapula means retracting scapula में problem होगी. The spinal root of accessory, when it is damaged, it will affect both sternocleidomastoid and trapezius. But when it is damaged in the posterior triangle, it has already supplied this sternocleidomastoid muscle. So sternocleidomastoid is not affected, trapezius is affected. So abduction of shoulder, abduction of arm is not a primary action of trapezius, right? It does take part in overhead abduction. Somebody has asked, so I want to address that as well. So it is not a very important muscle for it. Its main function is to kind of stabilize the scapula. Then it has the other action. Here the best answer, if you look at it, is the shrugging of the shoulder. Just look at the next question. You will be able to understand it a little better. A 43-year-old woman, she came with a large abscess in the middle of the posterior triangle of the right side. The physician incised and drained the abscess. So basically, this might have been a lymph node swelling in the posterior triangle, and that is why you have to be careful while incising it or dissecting it. And when the physician drained the abscess, 5 days later, the patient noticed that she could not extend the right hand above her head to brush her hair. Which of the following are the signs and symptoms of additional harm? So what has been damaged in the surgical incision, which is causing this symptom which she is not able to comb her hair, right? So to comb your hair, you have to carry out overhead abduction, all right? You have to carry out overhead abduction. Now, trapezius mainly carries out retraction of the scapula. It carries out depression of the scapula. It brings about rotation of the scapula. So trapezius does assist in abduction, but only in the overhead abduction, right? Because it rotates the glenoid upward. Now, so you are able to abduct your arm, right? You can abduct your arm, but you cannot raise it above your overhead. So the answer is C, a cut to the spinal part of accessory nerve, because that again damages your trapezius and it does not allow overhead abduction. It does not allow overhead abduction, that is abduction beyond 90 degrees. Abduction beyond 90 degrees. See, that is why we did not choose the answer as D here, because he did not mention overhead abduction. Alright. So here you had the option C, which was a better option. Here you have an option for cut to spinal of accessory where we are talking about overhead abduction. Right? Answer is C. Question 23. Inferior thyroid artery is a branch of. Here, thyroid, not internal thoracic artery. Inferior thyroid artery, it is a branch of. निमोनिक्स बहुत सारे हैं इसमें VIT और SIT होते हैं. आंसर हो जाएगा. ये बताना चाहिए ये वाला आई कौन सा है और ये वाला आई कौन सा 23rd A, yes, absolutely correct. Thyrocervical trunk. So this is vertebral artery, internal thoracic artery, thyrocervical trunk, and thyrocervical trunk has three branches: the scapular, inferior thyroid, and T for transverse cervical. Question 24. ये थोड़ा difficult है. The optic foramen, it is located between which of the following two? Optic foramen, it is located between of the following two bones. ये आसान क्वेश्चन नहीं है, थोड़ा सा मतलब बोनी एनाटमी जहाँ पे भी आ जाती है ना, देयर इज समटाइम्स अ स्लाइट डिफिकल्टी इन अंडरस्टैंडिंग. मेरे को अपना स्कल मेरा बाहर नहीं पड़ा है, अदरवाइज आई वुड हैव शोन यू दैट वेयर एग्जैक्टली द ऑप्टिक फोराmen is located. No, the answer is not B, but good guess. You're close, Mohammed Munir. The correct answer here is C, D, E, A. What is the correct answer? Does anybody else want to take a guess here? The optic foramen. So Mohammed Munir is not able to answer. Let's see who gives the fastest answer here. The answer is not B, Mohammed Munir for 24. This is incorrect. Greater wing and body of sphenoid. Not the answer, right? So, did I tell the answer? The answer is C. It is present between the lesser wing and the body of the sphenoid. Alright, it is present between the lesser wing and the body of the sphenoid. What is present between the greater wing and the lesser wing? This is the superior orbital fissure. This is the superior orbital fissure. Yes. So Niharika has taken a correct guess. It's not the D and A also. So if you want, I can show you a image. I can show you an image here of the in some. So look at this image. Look at this image. If you can make out this side, this is the lesser wing of the sphenoid. This is the greater wing of the sphenoid. So here is the optic foramen and this is the body of the sphenoid. So it is between the body and the lesser wing of the sphenoid. Between the body and the lesser wing of the sphenoid. So that's about this answer. Question 24. Now moving on to question 25. All of the following statements regarding the oculomotor nerve are true except. So which statement about the oculomotor nerve is oculomotor is the third cranial nerve. And guys, I will not give you much time for this because this is a very easy question. ठीक है, अगर ये आंसर मेरे को नेक्स्ट 10 सेकंड्स में ना मिले तो शर्म की बात. राइट, जल्दी. 1 2 3 4 5 6 7 8 9. Okay, 25 का C मिल गया. Very good. It innervates the lateral rectus. This is false, absolutely false, because SO4 LR6 है ना. So lateral rectus is supplied by sixth cranial nerve, superior oblique is supplied by fourth cranial nerve. Question 26. Uncinate process of the ethmoid is attached anteriorly to. Question should be that the uncinate process of the ethmoid is attached anteriorly. 25 is C. Who else is answering? Anjali is right. Mishti is written the right answer. Mohammed is answered correctly. Anjali, Niharika, every good. Okay, very good. Question 26. Uncinate process of ethmoid is attached anteriorly to. Again, this is a difficult question, and in fact, I was also a little confused about this. But the answer here is a little tricky because see, the answer cannot be okay. You go, then I will tell you. The answer is an answer of exclusion basically. If you have to actually do this, the Uncinate process. So first tell me, before you answer this, tell me from where does the uncinate process of the ethmoid originate from? Where does it take its origin, the uncinate process? Then you can think of the answer. Takes its origin from, where does the uncinate process? Okay, ये ना nasal cavity का सबसे confusing part है. This is the most confusing part of nasal cavity. So I've given you a hint that where it might originate from. It originates from the middle concha. It originates from the middle concha, which is part of the ethmoid bone. Okay, so that is its origin. Okay, it has various attachments. Its insertion can be at various different places. That is its origin. It attaches mainly to, okay, labyrinth. Not labyrinth. Okay. So I'll tell you the answer here is going to be the lacrimal bone. So lacrimal bone has an orbital process, right? Um, and sorry, it has a downward process, not orbital. It has a downward process, and to that the uncinate process is attached anteriorly. Yeah, posterior superiorly it is attached generally to maybe the inferior concha, right? But since the question asks attached anteriorly, that is why the answer given is lacrimal bone. Okay, but this is a slightly difficult question because it requires a lot of visualization from your end. So even if you're not able to do it, it's okay. But you should definitely see an image from an atlas of how the uncinate process is placed to get an orientation of this, right? Question 27, a question that has been asked in PGI also. The lacrimal duct opens into the. So where is the opening of the lacrimal duct? Where is the opening of the lacrimal duct? Now, why is this important is also something you should know, because at a very common thing in ophtha is the blockage of the lacrimal duct. Sometimes you need to create an alternative opening for that, right? And this is a good question. Where is the of the lacrimal? So I hope you know what is the sphenoethmoidal recess, what is the superior meatus, what is the middle meatus, and what is the inferior meatus. So the ethmoidal recess between the sphenoid and ethmoid meatus, between the superior and middle concha. This is the middle meatus between the middle and the inferior concha, and this is below the inferior concha, that is the inferior meatus. The answer here is 27 ka. There is inferior meatus. ठीक है. Mohammad Munir has given the right answer. Even Niharika has given the right answer here for this question number 27. The answer that is given is inferior meatus, right? Question number 28. The thinnest wall of the human orbit. Okay, so we have covered orbit, and I told you this also. What is the thinnest wall of the human? You have to tell the answer by choosing between the roof, right? The medial wall, floor. Floor is made up mainly of axilla and the lateral wall, right? The medial wall is made up mainly of the wide bone, right? These are two things that you can remember. Okay. So Niharika is saying B, that is medial wall, and then Mishti is saying A, the roof, right? To see why the roof can't be thin. The roof can't be thin because that is a communication with the anterior cranial fossa. That is somewhere you have some separation because the brain is present there, right? So the roof, well, that's just a way to think of it, but otherwise, it's more of a factual thing. And how this should strike you is that the medial wall is called as the lamina papyracea. It is called as the lamina papyracea. So lamina means sheet and papyracea means paper. So it is thin like a sheet of paper, so thin that in fractions of the orbit can directly communicate here, right, with the lamina papillaris. The answer is going to be B. 28th ka B is the answer is medial wall of the, that is the thinnest wall of the, right. So we are done with 28 questions. Let's move on to question number 9. So here is question 29 for you. What is the sensory nerve supply of the middle ear gland? Sensory nerve supply of middle ear. So this is the general somatic afferent fibers that have to come from the middle ear cavity, and they're brought by a specific nerve. There's also a name for the branch, the auricle for that matter. Okay. 29 people have started answering as B, right? So answer is glossopharyngeal. Now you should know here that some part is supplied by glossopharyngeal, right? There are two nerves that I have to tell you a little bit about. One is known as the Alderman's nerve, also called as Arnold's nerve. I think you can't see it, right? There's a ninth and there is a 10th. For the ninth, you have a nerve known as the Jacobson's nerve. Here you have the Arnold or the Alderman's. So vagus mainly supplies the external auditory meatus region, right? It does supply it, and if it does, yeah, it does supply it. And the ninth nerve gives a nerve known as the Jacobson's nerve, and it is one of the main nerves. The glossopharyngeal is the nerve that supplies the middle ear cavity. You know, it forms the tympanic plexus. It forms the tympanic plexus over the promontory, right? It forms a tympanic plexus over the, right? And this tympanic plexus also receives branches from the internal carotid plexus, that is the caricotympanic branches from the petrous part of internal carotid artery, plus you have glossopharyngeal. That is the composition of the tympanic plexus. Answer is option B here. ठीक है? Tympanic plexus वाला point समझ आया? So this is the promontory on the middle ear wall. You have this nerve coming here, giving a lot of fibers, forming some sort of a coil here. Then it gives a lesser petrosal nerve coming out from it, and then it also has a few fibers that are present as a plexus around the internal carotid artery, and cavernous part its cavernous part to have some branches come. This branches from it. Yeah. Question 29 is done. Question 30. What is the narrowest part of the middle ear? Okay, so this is not a question that I like too much, right? But since it was part of a question bank, I have to use it. Question 30, narrowest part of the middle ear. Because see, when we are considering ear thing to do, so we have to do it in both ways. We have to do it in a conceptual way. We have to do it in a way where we have to memorize a little, right? So I don't expect you all to know the answer to this question, but if you can take a guess, I'll be happy enough with that. A, B, C, D. Tympanum, right? So this is your middle ear cavity. Where this is your bones that I've drawn here. your bones. This is, let's say, your oval and round windows here. This is your oval window, this is your, and it is divided into, okay, so now you can tell the answer. Take a guess first. Then I'll say that this is the epitympanum, this is the mesotympanum, and this is a hypotympanum, because uh, this guess made a very little sense to me, and I felt that this question was a little data based. If you have some concept or logic here, do let me know. I also thought the answer is epitympanum, but it's not actually epitympanum. The answer is mesotympanum, as Mishti has correctly pointed out. The answer is mesotympanum. Why it is mesotympanum? Because I think that this is the dimensions for the mesotympanum. This is the dimension for epitympanum, and this is the dimension for hypo. Right? This might be done to keep the oscillations restricted in a particular area, because, but again, I'm not sure. So I'll just tell you here that it is, according to me, it is based on data or facts or figures, but there might be a logical explanation as to why this is happening. Okay. Question 31. Inner ear is present in which bone? So you have to tell me in which bone is the inner ear present. Okay, this is a good question, because sometimes we forget that inner ear is actually a part of another bone, right? It is not a bone in itself, it is part of another bone. Fairly easy guess to take. So if you have to kind of memorize the previous question, I can probably make something for that. You want to remember it as a fact. Let's try and make a trick out of it. 31, Mishti has written the answer as B. Does anybody else agree with Mishti's answer? Okay, Sangam, welcome Sangam to the quiz. The answer is correct. It is the petrous part of the temporal bone, where you have the inner ear, and it is present inside the cavity of the part of the temporal bone. So if you have to remember this particular question, right, what I will do is, let's take a black screen. I will create a visual in your head that will ingrain this concept. Hai na? Let's create a visual. Right? So let's say this is the roof, right? And this is your middle ear. Right? Now I want to look at the middle ear cavity from this side, right? This is your middle ear cavity, and I want to look at it from this. When I look at it from this side, what do you have here? You have the, this is the lateral wall, where you have the tympanic membrane, and this is the medial wall of the middle ear cavity, where you have the promontory and everything, right? So the visual that you want to create is this, right? So your middle ear cavity is like a biconcave lens, where this is the epitympanum, which is 6 millimeters in diameter. This is the narrowest part, mesotympanum, which is 2 millimeter in diameter. And the hypotympanum is slightly larger than the mesotympanum, but smaller than the epitympanum. So this is 4 millimeter. So now I hope this helps you remember that this is 6 to 4, है ना? थोड़ा सा शायद इससे better याद हो जाए. Otherwise, no worries, not very important. Okay. Question number 32. Cervical esophagus receives its blood supply. Cervical esophagus receives its blood supply from. Cervical esophagus is the part of the esophagus which is present in the neck, right? Cervical means neck here, right? Part of the esophagus that is present in the neck. From where does it derive its blood supply? Where does it derive its? Only to be yes, right. Sorry, there was some lag in my connection. Sangam has written the correct answer, Niharika has written the correct answer, and Mohammed Munir has written the answer. Is inferior thyroid artery. I think Niharika has taken a guess, and our guess went very good. Superior thyroid artery, as you know, it is a branch from the external carotid artery, and it will ascend upwards, so it will not get a supply here. Inferior thyroid artery it arises from the first part of the subclavian, right? It is a branch from the thyrocervical trunk. So it goes downwards. So inferior thyroid artery is the correct answer here, right? The facial artery will enter the face. It has no little relevance here. It is also a branch from the external carotid artery. And the lingual artery is also related to the facial structure, right? Bronchial artery is too inferior here, right? Question 33. Throat pain radiating from to the ear following tonsillectomy. So removal of tonsils is tonsillectomy, and throat pain radiates to the. Since tonsils they have a very prominent blood supply, right? So one of the things that you have to do here is you have to check that whether there is a hemorrhage by removing the clots that are formed during the surgery. Okay, and that is similar to one other place. Okay, I'll tell you this concept. There are two things that are common to tonsillectomy and postpartum, right? That you have to ensure that there is no hemorrhage by removal of clots, right? So here you remove the clots just to make sure that there is no actual hemorrhage. In other places, that clot formation is encouraged. You have to let the clot be because it is stopping the blood flow. But in these two places, since they have a very rich blood supply, you have to make sure that there is no hemorrhage because the clot might be uh, kind of hiding that or making that latent sort of. Yeah. So 33, the answer is okay. Mishti has first written C. The answer is not C, but then she's written B. That's the correct answer because glossopharyngeal nerve it has a supply to the ear through the Jacobson's nerve, that is your which is going to your middle ear, and it also has supplies the tonsils, which are present in the oropharynx, present in the right. Question 34. Pain in the posterior one third of the tongue. Pain in the posterior one third of the tongue after tonsillectomy is due to injury of. Logic. 4 is also B. Same logic. Posterior one third of tongue again supplied by Glossopharyngeal nerve, you know, it brings both general sensations as well as gustatory sensations from these two regions, and this pain in the posterior one third of the tongue after tonsillectomy is due to the injury of I look no, nothing like that. It's probably what hostel life does to you. I might have slept late. Question 35. Skin at the angle of the jaw is supplied by the typo. Skin at the angle of the jaw is supplied by. There is some error here. The options have gotten let's see these options. Correct. You have to tell me which nerve supplies the skin at the angle of the jaw. Tell me the name of the nerve, because this is a slightly important, the cutaneous distribution or the cutaneous supply of the face. Yes, Sangam has written correctly. Great auricular nerve is the nerve that supplies the skin at the angle of the jaw. Great auricular. Yes, somebody's not the inferior alveolar. So basically, this is the distribution. This is the distribution. Okay, I'll draw it in a better way. Are you able to hear this drilling noise? But there's the small part which is supplied by the greater auricular nerve. There's a small part that is supplied by the greater auricular nerve, that is C2, C3, right? And this is slightly important to remember, because if there's a damage to the trigeminal nerve, this part of the skin is spared. This part of the skin is spared, right? So I told you that these options are wrong. The question that was supposed to be here was damage to question number 37 पे चलो. Question number 36. Cranial nerve emerging between the pyramidal and the olive eminence. You tell question 37 first to me. Till that, I will look up what question 30 I had planned for you all. Cranial nerve that emerges between the pyramidal and the olive eminence. This is the cranial nerve which emerges between the pyramidal and the olive eminence. So this section of the brainstem where you had to draw all the cranial nerves is, you should know exactly. Third nerve somewhere here, nerve dorsal ones coming from here. English comes and then between the pyramid and the olive, you do not have the seventh cranial nerve. Do not have Muhammad Munir, the seventh. Sixth cranial nerve also, you know, is emerging at these two nerves are basically emerging along with the eighth nerve at what is known as the pontomedullary junction. Emerging at the pontomedullary junction. For the eighth nerve, you can also say cerebellopontine angle. That is the angle that is present. The word that we use here is the pontomedullary junction. That is the junction of the pons in the medulla. Okay. Sujal Bahal has a doubt here. Do it in a better way because this is. बताओ Sujal Bahal doubt बताओ. If you have some specific doubt, you can let me know, or I'll explain this question in a problem. First, tell me. हाँ सुजल देख लिया आपका डाउट है. थर्ड में ये आपका ये क्या बनाया मैंने जो नहीं चल रही है एंड ठीक है. तो आई गेस ये तो रसोड़े में कौन सा डाउट था, ये वाले डायग्राम से समझ आ गया. देख लेना इसमें रसोड़े में. तो आंसर इज गोइंग टू बी 12th cranial nerve because the 12th cranial nerve it emerges here. If this is your central line and this is, let's say, your pyramid, this is your olive. Your 12th cranial nerve emerges at multiple rootlets from here, and that is how the 12th cranial nerve. Right. Question number 36 that we have skipped. Question number 36 that we have skipped. I'll just write that down for you. Oculomotor nerve palsy, that is the cranial nerve palsy of the third nerve, all are seen in third cranial nerve palsy except. So your options here are the ones that were in the previous question. You have mydriasis as an option. You have meiosis as an option. Then you have ptosis and the outward deviation of the eye. Ptosis and outward. These are all the options that you have in oculomotor nerve palsy. Which of the following does not occur? All are seen in the third cranial nerve palsy. Yeah, so question number 36. Outward deviation of the eye. Right. So, Muhammad Munir, why will the outward deviation of eye not be there? Think of it in this way, that cranial nerve third, it supplies the medial rectus, but it does not supply the lateral rectus. If the medial rectus does not work, obviously the lateral rectus will take it outwards. It will take it outwards. So there will be outward deviation of the eye. E is not the correct answer, Muhammad Munir. Shivangi Garg has answered correctly that the answer is D. Why? See, first thing that you have to do whenever you see such a question, you have two options, mydriasis and meiosis. They are both contradictory things, right? You can either have mydriasis and you can either have meiosis. You can't have both, right? So whenever you see such a question where there are contradictory conditions which cannot occur simultaneously, you can remove that B and C will not be the answer, so that you don't make a mistake here, right? And the third cranial nerve, it brings parasympathetic fibers from the Edinger-Westphal nucleus, right? And those parasympathetic fibers, they will supply the constrictor. Now, constrictor pupillae causes meiosis. Now, how do you remember that meiosis is constriction of the eye? I used to think of it in this way, that meiosis is cell division, right? This is meiosis, cell division, and in cell division, the cell constricts. The cell size becomes smaller because two cells are formed, right? That is how I used to remember that meiosis means constriction of the eye, and constrictor pupillae will cause meiosis. But damage to the constrictor pupillae, that will not allow meiosis to occur. So there will be the opposite, that is mydriasis. So mydriasis occurs while meiosis does not occur. So the answer is B. right? Meiosis. Now let's move to question number 38. Where does the subarachnoid space end? Where does the subarachnoid space end? And you know subarachnoid space, what it contains. Does it contain the CSF? Yes. Subarachnoid space contains the CSF. Till which level in the spinal cord does it extend to? If you guys want the PDF of all these questions, you want to send it to your friend or to your girlfriend, the Telegram channel is @NEET PG Chetanya, and I'll be uploading all the PDFs there, and you can see those, right? Then you can also join Unacademy's Telegram channel, where all updates on Academy PGs. So we've got a lot of answers. So see, this option is L2 basically, L3, S4, and this is S2. Subarachnoid space, it extends till S2. Still, the answer is going to be right. See, the dura and the arachnoid, they end at S2, right? Dura and the arachnoid end at S2. So because they end here, the subarachnoid space also has to end here, right? But you usually take a lumbar puncture from L3, L4, right? Or some books say L4, L5 even for adults, right? L4 or L4, L5 in adults, right? For lumbar puncture, because here you will also get sufficient CSF. You will also get sufficient. There's very little CSF. You go to levels below this. I will put up a combined messages of all the classes I have taken with links in the. You can also join my Telegram channel so that you are able to get all those classes summarized there, because वहाँ पे already link सबका वैसे डाला हुआ है, if you scroll up, but I'll also try to create a message. Okay. Question 39. Blood supply of the hippocampus is. Okay. ये मैंने बताया नहीं है. Niharika, what you are talking about is the level of the spinal cord. ना? So what Niharika is saying is that वो भी L2 नहीं होता है, उसमें क्या होता है, your till your birth, at the moment of birth, your in and that means in children, your spinal cord, it ends at L3, right? It ends at L, and whereas in your adults it ends at L. Yeah, subarachnoid space. You can you can refer to any textbook if you're unsure of the answer. In your mission answer as well. Subarachnoid space obviously extends beyond it, because see, where do you take the spinal tap or the lumbar tap, है ना? Your spinal cord ends at almost the level of L1, L2, right? But your subarachnoid space, it extends till S2. I am very sure of that. Yeah. Niharika got confused also. ठीक है. That's no worries. हाँ. Yeah, right. He was talking about the chorda equina, that is all the collection of the spinal nerves that are going on. We're talking about the main trunk of the spinal cord. Okay. So subarachnoid space, it does extend beyond the tip of the cord, and it goes up till S2, where you have the other meninges attaching the dura and the pia even continues down as the phylum terminal, right? There's a phylum terminal internus which goes along with the dura and the arachnoid, and there's a phylum terminal externus that even continues till the, right? The blood supply of hippocampus. Question 39. No worries, Niharika. It's okay. We all get confused. Perhaps I'll get. Question number 39. What is the blood supply of hippocampus? Question number 39 asks you the blood supply of. Oh, you don't know this, right? You don't know. Okay. Chalo, tell me at least this. So it is already given that the medial and lateral striate arteries are branches from the middle cerebral artery. Tell me that anterior cerebral artery is a branch of. What is it a branch of? Tell me what anterior choroidal artery is a branch of. Tell me what the middle cerebral artery is a branch. First question for you is, then we'll talk. I'll tell you the blood supply of the hippocampus. Okay. If you don't know the answer, let me know so that I can go ahead and explain it. Yes, the anterior cerebral artery is a branch of the internal carotid artery, right? The funny thing is that all of these are branches of the internal carotid artery. So if you haven't watched the lecture, you should watch the lecture on blood supply of the brain and spinal cord. I've explained the circle of Willis in detail. I'll cover it a little again. This is the internal carotid artery. I'll only cover the anterior system. The anterior cerebral artery goes in front. It is connected by the anterior communicating. Then it gives a very large branch. That is the middle cerebral artery, right? Which gives lenticulostriate arteries, medial and lateral, by the central cortex and everything. And then you have a few branches by the basal ganglia too, right? Then you have posterior communicating arteries which go backward, right? From here you have an artery going that is known as the recurrent artery of Hubner, and have another tortuous branch, long, narrow branch coming from internal carotid artery that is known as the anterior choroidal artery. It goes and supplies the choroidal plexus of the inferior horn of the lateral ventricle, right? And it also gives a branch to the answer is going to be anterior choroidal artery because it gives a branch to the question number 40 carotid sheath. Fairly of the mystery has given a pretty fast answer, that is phrenic nerve. Absolutely correct. So now if you know the placement on the medial side, you have the on the medial side you will have the internal or the common carotid artery running depending at which level we are talking about, right? So you will have the carotid artery basically. Then you will have the internal jugular vein on the lateral aspect, and posterior lateral to the carotid artery you will have the structure which is the vagus nerve. You will have the right. So the answer is going to be D, phrenic nerve. So phrenic nerve, it does not pass in the carotid sheath. In fact, it is related anteriorly to the cavernous anterior, right? Not the phrenic nerve. ठीक है. अगर मेरे पास डायग्राम होता ना एक तो बड़ा मस्त समझ आता है वो. इफ यू लुक एट द डायग्राम ऑफ, इफ यू कम अक्रॉस द ट्रांसवर्स सेक्शन ऑफ द डीप फेशिया ना, तो उसमें ना ऐसा वाला डायग्राम होता है एक, ऐसे वाला सा. उसमें यहाँ पे पीछे वर्टिब्रा दिखाया होता है. यहाँ से वो प्री वर्टिब्रल फेशिया बनाते हैं, यहाँ पे प्री फेशिया बनाते हैं, यहाँ पे स्टर्नोक्लेडोमास्टोइड को कवर करते हैं टेस्टिंग लेयर. तो वहां पे उन्होंने फ्रेनिक नर्व दिखाई होती है. सो दैट इज अ गुड डायग्राम. ठीक है. To understand the phrenic nerve, its relation with the fascia, to understand its relation with the scalenus anterior. Scalenus anterior यहाँ पे होता है उसमें. ठीक है. तो वो वाला डायग्राम एक बार देखना, इससे अच्छा समझ आता है. ओके. तो क्वेश्चन नंबर 41. Secretomotor fibers to the parotid is via which nerve innervates the parotid? Which nerve innervates the parotid? It is via. So it is asking for the topographic nerve. It is asking for the topographic nerve that innervates the parotid gland. ठीक है. Functionally, parotid gland is innervated by the glossopharyngeal nerve, the ninth cranial nerve, via the inferior salivatory nucleus. These fibers come in a very complicated way, right? Himanshu Rateria, fast answer he has given is auriculotemporal nerve. Absolutely correct answer. That is also how I remember the Frey syndrome, or मतलब Frey syndrome के through ये याद है मेरे को. That Frey syndrome is gustatory sweating related to the parotid, where it is also called as the auriculotemporal syndrome. The parotid is supplied by the auriculotemporal nerve. No doubt in that. Himanshu, Mishti, Niharika, very good. Question 42. Relation of the facial nerve branches to parotid gland. So can you tell me what is the structure that is formed by the facial nerve branches called as? ऐसे याद नहीं आएगा तुमको. It is called as pes anserina. It is called as pes anserina. Okay. Basically this ऐसा structure होता है. It looks like the foot of some bird or some animal, right? So pes is foot, and this kind of an arrangement is known as pes anserina. There's also a playlist of all the videos that I have made so far on my YouTube channel, on Unacademy's YouTube channel. Yes, Mishti is right. This is called as PES, and this is the temporofacial nerve, the cervicofacial nerve. Then you have to use the mnemonic तेरी जिंदगी भर मारुति कार. So 10 zebras bit my cat. The temporal nerve, the zygomatic nerve, buccal nerve, marginal mandibular nerve, and cervical. Right? The S answer na, and it is related to the. Okay, so 42 people are saying B. Niharika and Misty, no, you're wrong. It is not deep to the gland. It is not superficial to the gland. It is present inside the substance of the parotid gland. All of this occurs inside the substance of the parotid gland. So the external carotid artery does enter the parotid gland, right? And so that is why whenever you do parotid resection, you have to use a specific plane, all right, that you don't damage the facial nerve, right? So parotid resection is done in such a way so as to avoid damage to the facial nerve. So you have to do, there's a superficial part, there is a deep part in the isthmus of the parotid, and the facial nerve encircles around it like this. So this is the plane in which you have to cut the superficial and the deep separately while doing the parodectomy. Alright. So that is what you have to do, right? Yeah, is there any doubt here? Is there any doubt here? 43. What is the upper covering of the cochlear duct? Upper covering of the cochlear duct. क्या आसान क्वेश्चन है यार. अपर कवरिंग कौन सी है, बेस पे क्या है, पता होना चाहिए. कॉक्लियर डक्ट इज अ गुड स्ट्रक्चर and this you have even studied in your 11th 12th also. हिमांशु रटेरिया काफी फास्ट आंसर देते हैं, काफी आंसर देते हैं. So हिमांशु रटेरिया and Mishti both are given the right answer. The answer is tectorial membrane, which forms the upper covering of the cochlear duct. Right? Question 44. Fate of the sixth aortic arch. Sixth aortic arch का fate क्या होता है? Very good. So ये aortic arch वाला ना, if you have the book Langman's embryology, there's a very good diagram there. That is the standard diagram for the. It's a standard book for embryology, and it's all you need to read for embryology. Alright, and this is a very nicely written book, and I would really say that do read embryology from here. And there it has been explained what is the fate of the sexual way. So remember all the six degenerates. Alright, right. 44 B ductus arteriosus. Can you tell me which structure coils around the ductus arteriosus? Which structure coils around the ductus arteriosus? Which structures? This one specific structure, ठीक है? And I want you to tell me the side also, left के right. Yes, recurrent laryngeal nerve. That's right. So Niharika, just you specified it is the left recurrent laryngeal nerve, and you should know that the left recurrent laryngeal nerve it will supply all the muscles of the larynx on the left side except the left cricothyroid. It will be supplied by the external laryngeal nerve, right? This is important statement to remember. Then question 45. Which of the following are features of Horner syndrome? Which of the following are features of Horner syndrome? So multi answer correct is what I expect here. You have to tell me what are the features of Horner syndrome. Key important feature. So multi answer correct. ACD. Slightly wrong. Okay, so you are correct with respects to A and D. There is ptosis, there is anhydrosis, right? These two are correct. Ptosis is related to the LPS, levator palpebrae superioris, which has a sympathetic part, right? It has a smooth muscle part. Will there be meiosis or will there be mydriasis, right? So Horner syndrome, there is a damage to sympathetic fibers. There is a damage to the sympathetic fibers. And the sympathetic fibers, they are responsible for what function? They're responsible for meiosis, or are they responsible for mydriasis? Okay, Manchuroteri has also said ACD. They're responsible for mydriasis, that is opening of the pupil, right? Matlab enlargement of the pupil, right? That is what they cause. But since they are damaged, there will be no mydriasis. There will only be meiosis. It is D. It is A, B, D. Himanshu Rateria is also wrong. Niharika is also wrong. Answer is A, B, and D. ठीक है. Think very conceptually. What happens in Horner? ये रट्टा नहीं मारना है क्या होता है? Horner syndrome, damage to sympathetic fibers. Sympathetic, you have to gain more stimulus. So obviously there will be enlargement of pupil for sympathetic fibers. But if there is damage to sympathetic fibers, there will be no enlargement. So there will be no mydriasis. So there will be. That is how you have to go about this. Okay. रट्टा मत मारने अब. Himanshu, is it clear? Question 46. Which of the following is the site of cerebellar input? Which of the following is the site of cerebellar input? Right? ठीक है. ये cerebellum के connection से related question आ गया. Efferent to cerebellum. Which of the following is the site? We'll try to finish it in another 5 minutes or so. Today we are going to be doing 50 questions, है ना? And like I told you, again we have the session tomorrow. Please set a reminder for it. Tomorrow we will have covered 100 questions and day after tomorrow we will have covered 150 questions. पूरा head and neck तैयार हो जाएगा. Entire head and neck, and since neurophysiology is related to that, after that I will have one session for MCQs for neurophysiology. That will cover most of what you need to know for head and neck, for your physiology also. तो ये sexy हो जाएगा. Not vestibular nuclei. Think a little more. क्या कनेक्शन होते हैं यहाँ पे? Okay, inferior olivary nuclei. Absolutely correct. Himanshu Rateria has given the right answer now. Wrong answer. 47. Chasnax tubercle. अरे मजा आ गया. ये वाला मैंने बताया था. What is the Chasnax tubercle? Okay. Chasnax tubercle का मेरे को पहले alternative name बताओ. First tell me what is another name for the Chasnax tubercle. Then tell me the answer of the 47. What is the Chasnax tubercle? उससे उसकी significance भी आ जाएगी. Right? लेवल भी पता होगा. तो Chasnax tubercle. Chasnax. Chasnax. इसको pronounce करना बहुत मुश्किल है यार. I prefer the other name of this tubercle. If you don't know the answer, just write I don't know. Alright? So that I'll be explaining you. Yes, Niharika is right. It is also called as the carotid tubercle because it is a site where you can palpate the common carotid. So if you can palpate here the common carotid artery, so it must be definitely below the level of C3, C4. Why? Because that is the level where the common carotid artery bifurcates. Right? So the level, if you have to guess, of the carotid tubercle, guess below C3, C4. ठीक है? C3, C4 के नीचे होगा तो कौन से लेवल्स हो सकते हैं? C5, C6 ना. अब इन तीनों में से कोई एक लेवल है. C5 is above the level of cricoid cartilage, C6 is at the same level of cricoid cartilage, and C7 is below the level of cricoid cartilage. Now take a guess for this answer. कि किसी सिस्टमैटिक अप्रोच में जाना जब भी किसी भी क्वेश्चन के बारे में सोचना है. अच्छा, कॉमन कैरोटिड पैल्पेट होती है ना कैरोटिड ट्यूबर की. कॉमन कैरोटिड C3 C4 पे तो बाइफरकेट ही कर जाती है, तो C3 C4 तो नहीं होगा आंसर, मतलब लेवल. C3 C4 नहीं होगा तो बचे ये तीन C5 C6 C7. क्रिकॉइड कार्टिलेज का लेवल क्या होता है? C6. तो ये अबव क्रिकॉइड कार्टिलेज हो गई, ये बिलो क्रिकॉइड कार्टिलेज हो गई. इट इज प्रेजेंट एट द. तो अगर लेट्स से द आंसर इज C7, लेट्स से द आंसर इज C7, लेट्स अज्यूम द आंसर इज C7. ठीक है, फिर ये दोनों सही हो जाते हैं, बिलो द लेवल ऑफ क्रिकॉइड कार्टिलेज और प्रेजेंट एट C7 लेवल. बट फिर ये दोनों हम इसको एलिमिनेट कर देंगे क्योंकि एक सही सिलेक्ट करना है हमने. अब अबव बचा और एट द सेम लेवल बचा. ठीक है, आंसर इज एट द सेम लेवल ऑफ क्रिकॉइड कार्टिलेज बिकॉज कैरोटिड ट्यूबरकल इज द ट्यूबरकल ऑफ. तो तुक्का मारना है, बहुत इंटेलिजेंटली मारना है, बहुत सारे फैक्टर्स कंसिडर करने हैं, फिर तुक्का मारना है. क्वेश्चन 48. फॉलोइंग फोरामिना आर फाउंड इन द ग्रेटर विंग ऑफ sphenoid bone except. Following foramina are found in the greater wing of the sphenoid bone except. Optic canal, absolutely correct. Optic canal is present between, it is present between the body of the sphenoid and the lesser wing of the sphenoid. The rest of the three, they are present on the greater wing of the sphenoid. This is R, this is O, this is X. Foramen rotundum, foramen ovale, foramen spinosum. They are present in this sequence. So remember reactive oxygen species when you think about these. Yeah, so these are the three foramen that are present in the greater wing of sphenoid. And these are the three kind of important foramens. Rotundum, you will have maxillary nerve passing. Ovale, the mnemonic was ovale or male. The mnemonic for spinosum was men. तो ये इंपॉर्टेंट है याद. सेकंड लास्ट क्वेश्चन. इंटरनल थोरैसिक वेन्स आर ट्रिब्यूटरीज ऑफ. ये थोड़ा सा थोरिक्स का पार्ट हो गया. If you know it, well and good. But first tell me internal thoracic artery किसकी branch होती है? Internal thoracic artery is a branch of. First tell me internal thoracic artery is a branch of. Then we will talk about internal thoracic vein. I hope you know in the venous system, the subclavian vein and the internal jugular vein they combine to form this trunk that is known as the brachiocephalic trunk. Yeah, this is the subclavian vein. Yeah, zygus तो यहाँ पे neck में नहीं है. Yes. So the internal thoracic artery, it is a branch of the first part of the subclavian artery. The branch from the first part of the subclavian artery is included in VIT, right? Vitamin. है ना? So, but the internal thoracic vein, it is not a branch of the subclavian vein. It is not a tributary of the subclavian vein. Okay. अब internal jugular की तो हो नहीं जाएगी. तो बची कौन सी? It directly drains to the brachiocephalic vein. It directly drains to the brachiocephalic vein. यहाँ पे there is a difference between how the internal thoracic artery drains, और मतलब it comes from, it is a branch from the first part of the subclavian artery, whereas the internal thoracic veins, they are tributaries of the directly of the brachiocephalic. ठीक है, 59 में आंसर डी हो गया. लास्ट क्वेश्चन 50, इंटरनल लैरिंजियल नर्व सप्लाईज. व्हाट इज द नर्व सप्लाई ऑफ द इंटरनल लैरिंजियल नर्व? अभी मैंने 3 नर्व्स की बात कर चुका हूँ, इसकी अभी बात एक्सप्लिसिटली नहीं करी है. इंटरनल लैरिंजियल नर्व, external laryngeal nerve and recurrent laryngeal. ये मान लो vocal है, ये larynx. 49 का आंसर हो गया डी. करेक्ट. अंजलि इज राइट. लास्ट क्वेश्चन ऑफ द डे. फिफ्टियथ का सी, म्यूकस मेम्ब्रेन अबव द लेवल ऑफ द vocal fold. दैट्स राइट. तो देखो इसमें अब थोड़ा सा सिस्टम ऐसा है, ये याद रखना, एक्सटर्नल लैरिंजियल नर्व इट सप्लाइज ओनली वन मसल, दैट इज द क्रीकोथायरॉइड मसल. ये हो गया मस्कुलर सप्लाई में इसका. It supplies recurrent laryngeal nerve supplies all muscles of the larynx except the cricothyroid because it is supplied by. Then sensory supply above the vocal cord comes from internal laryngeal nerve. Below the vocal cord comes from sensory mucosa of the vocal fold. Sensory. Anjali and Mishti both have given the right answer. ठीक है, तो ये इसके साथ हमारे टोटल 50 क्वेश्चंस खत्म हो गए हैं. सो वी हैव कवर्ड 1 to 50 क्वेश्चंस राइट नाउ इन अ वेरी शॉर्ट स्पैन. तो इससे आई गेस आपका एक पूरा रिविजन काफी टॉपिक्स का, हेड एंड नेक का भी, न्यूरो एनाटॉमी का भी हो गया है. ठीक है, तो आई जस्ट से दैट टू टेक. so first let me tell you about all my videos since somebody asked. One, the first video that I made was head and neck part 1, right? Then part 1 where I had covered scalp, temple, face जो आपके BDC pattern पे है, right? Second thing that I had covered in this lecture itself was all. Yeah, then I took part 2 in which I covered cranial nerves 1, 2 and all the columns, right? Then I took part 3 where I covered cranial nerves number 7 to 8 to. Then I took part 4 where I covered nasal cavity plus pharynx. Then I took blood supply of head and neck plus brain plus other like capsule. And then last lecture that I have taken today is the MCQ Marathon. This is a 3-part series, MCQ Marathon 1, 2, after which I will take Euro. With that, I will try to conclude all your head and neck. And these are all the videos that you can watch of mine, and you can also subscribe to my Telegram channel at the rate NEET PG Chetanya. Get their links also and the PDFs. So let's crack NEET PG. Hit the bell icon for notifications ताकि जब भी मैं live जाऊँ आपको पता चल जाए. Hit the subscribe button to stay followed here, and use my referral code Chetanya10. Get the 10% discount. I'll tell you how to get 10% extra. I'll give you some perks from my end. मिला के 20-25%. ठीक है? तो I would really recommend कि आइकॉनिक सब्सक्रिप्शन ले लो भैया. प्राइस बढ़ने वाला है soon. So that's about it from my side. If you have any other doubts, you can always approach me. Yes, I'll be ending the stream now. Yeah, if you liked the lecture, please do hit the like button for the lecture after I end the stream, and do drop in a comment if possible.